How do we avoid that very grim future, Anthony? How do we save ourselves from getting to that space where we are going to allow depression run our lives? I believe it has already even started. If you look at what is happening in the country right now, and the news that we are receiving left, right, and center, from relationships to what is happening to the young people, the rates of infections among the youth. How do we save ourselves for the future that is coming?
Speaking, looking for help.
Speaking and looking for help.
Looking
That's
for
a good
help.
point.
Looking, just find somebody. Find somebody. And I want to encourage basically everyone, both the ladies and the men. But you know, one thing I say about our women is that them, they open up. Tukienda kwa chama tunajifungua. Tunajifungua. Even I will say, you know, my husband, imagine nilimpiga suti asubuhi, pasi amemwagia chai. Then lazima niende. You see, you learn to get it out. You get it out of your chest. But for us men, we will hold on to something. We will bottle up a lot of issues inside us. We bottle them up, And I will walk out here looking confident, but inside nothing is working. We need to look for help. We need to go for therapy. If you feel I don't have somebody I can speak to, there you will get the confidentiality you need. You will get somebody who is non-judgmental, who is ready to listen to you. And sometimes, not sometimes, we have solutions to our own problems. We don't go to therapy to be given advice. We don't go to therapy to be guided. We go to therapy to be helped. That it is like ni kama kufungua tu akili. You unblock, because it's like the mind gets stuck. All the things that happen you come to a point you get stuck. You need somewhere where you can be given that opportunity to open up and to get the solutions for yourself. That is all about therapy.
It's easier said than done, especially when you're talking to people of your gender, Daktari. How do you identify these people to talk to? You know, because it's not just about going around talking to anyone, right?
Yes.
Not everybody knows what to do when you come to them and you talk to them about issues you're going through. So how do you identify the right person to talk to? Somebody who will actually offer solutions or help you in that journey. How do you get to that particular decision?
Well, that is a very open question, but I will phrase it this way.
Yeah.
That you need to find a qualified, and we have currently what we call the Kenya Counselors and Psychologists Association. They are professional associations that have their memberships online, where you can verify the name and the credibility of the person you're dealing with. So in the initial period when you feel a disturbance, I believe that the doors open are usually to go into a primary healthcare clinic and report your symptoms, upon where you will be referred to a secondary care provider in case they decipher that what you're suffering from is a mental health condition. Let me give you an example of primary health care and how it has helped us uncover mental health conditions that people did not know existed. And that is the point at which identification should be done at the primary health care level, the dispensary, the community, and the health center. Professor Modani Madhayo of the Nairobi University last year, 2023, did a study where they were checking for the effectiveness of antidepressant medication called fluoxetine, together with psychotherapy for treating depression. Now, inadvertently, they uncovered in the study that Kenyans are a very traumatized lot. 35% of the patients or the people who they queried in that study had PTSD, post-traumatic stress disorder. And then a further 26% of them were found to have depression. Now, let me tell you something about mental health. Conditions co-occur together. Conditions marry each other. It is very possible to find somebody with depression having a substance use disorder. They are called comorbidities. Two conditions occurring at the same time in one individual. So we have a comorbidity epidemic in this republic of mental health conditions because they are coming in pairs. You get? You get in somebody with anxiety has a sleep disorder. They cannot sleep at night. Those are two co-occurring things that need to be sorted out separately. And as we say in medicine, comorbidity is the rule rather than the exception. So I would like to encourage Kenyans to start seeking therapy and interventions for their mental health concerns.
What if they've not gotten to that level of awareness to even know when they need to go to the facility or to get that diagnosis? What do they do at the basic level, at the household level? How do we deal with these issues?
Okay.
Yeah?
I will give one technical and one non-technical answer to that. So the Kenya Red Cross, together with the Rotary Club of Nairobi Lavington, have come up with a free self-diagnosis portal where you can dial the number *789*1199#. And once you dial those numbers, you will go through a series of questions that have every condition under mental health. And it will take you through a self-diagnosis procedure, at the end of which you will get results telling you whether you have a condition or not. It is free on your phone right now, you can try it. And at the back end of that, the mental health and psychosocial support team at the Kenya Red Cross, which is free, led by Dorothy Anjuri, are waiting to offer psychological first aid and signpoint anybody who may be affected to the nearest point of care in the counties. So there's an intervention that is there already that is scientific for the population to check themselves. Now, when the World Health Organization did something we call the reorganization of mental health services, they put self-care as the first point of entry for everybody.
Yeah.
So now initiative rests on the person, but there are parties and bodies that have brought out diagnosis tools, simplified manner, on your phone as a USSD, where anybody in their houses in the whole country, because we thought it prudent that even the most basic phone can help you access that service, can get to know the prevailing conditions that they have within themselves and seek care. That is one of them.
All right.
The second one is that people are usually using a lot of social media these days. We have a 66% internet penetration. And through the media, the internet is now available in every corner of this country. And I would encourage people to get online for learning purposes, not only entertainment.
All right. And Anthony, I want you also to talk to me about the significance of reaching out to each other, checking on each other, having these very basic conversations about what's happening in your life. Where are you at? How can that help us to save more lives from going down the drain of depression as well?
That is one of the most important things, I think. And as you've asked, down from home, just finding that person that I can share with what I'm going through. And by doing that, we tend to prevent a lot of things that will happen. Just get that one person that you think you can trust. And let's start from the people around us. Look for somebody that you can confide with, somebody you can share. Just share anything you feel you need to share. And out of that, if you get that person, you will be able to open up. And that, I think, will help us to deal with some of these issues before they get to a place where now we'll need, again, medication. Because it starts as a simple thing as just anxiety. As simple as anxiety. And especially right now, as we are all talking about high cost of living, that is in itself, it is enough to drive somebody down to depression. Just that in itself. And we'll just be talking about it, how mambo ni mbaya, things are so bad. You see, when somebody is talking about that, in their subconscious mind, it is slowly eating into them. And that now, you start looking at your life where you are, you start seeing how things are going, now you start seeing things are not working. But if you get to open to somebody, they will help you to start seeing life in a different way. Looking at life and just deciding in a way to deal with the here and now. Where am I now today? You know, because sometimes it is not the now today, as I've mentioned. We are stressed by things even for the next or coming in the next 10 years. Not even today. Today you might be having everything.
Yeah.
Everything, you have everything. But tomorrow becomes a problem to you. And that is why I'll again echo is let's seek counseling. Let's seek counseling.
What if those people you're seeking are also going through the same? Unaambia mtu maisha ni ngumu, anambia by the way, it's kila mtu, it's everywhere, you know. Tujikaze, you know. Do we have a population that is also empowered to receive people and to offer grace and listen to them and encourage them, or are we all bleeding?
Thank you, Safin, for those sentiments. I would like to say and state that we need to have a very honest conversation about mental health, and I will start by being vulnerable myself. You know, we have suffered personally, close family members, my friends, my workmates, and significant others that I know within my ecosystem. I have so many people who have expressed concerns for themselves. And so I believe mental health is here with us. Each one of us knows somebody somewhere who might be suffering from a condition or other. There is somebody's son who has refused to go to school because they are in their bedrooms locked up because they take drugs. You have so much stress at your workplace, and probably your boss might be a bit mean, and you are so overwhelmed, and you have burnout, and you have stress as a result. Mental health is now with us. It is everywhere. It is actually the person next to you. If they were very honest with you and you had a candid conversation, they have a personal concern or somebody that they know who is currently going through it. We have to be each other's keeper. Sorry to divert a bit. He mentioned subconscious mind, and it rang a bell in me again. That most of the things that disturb us in our quiet moments are things we have planted inside our subconscious mind. Now, the mind describes the entire circuitry of the brain and the physical brain itself. Everything that goes on in there is called the mind. Now, the mind is divided into two. 5% is the conscious mind, which we use to walk around and do the things that we are doing, moving my hand and so on and so forth. We have 95% being subconscious, and that one operates below conscious awareness. Now, the problem is people are planting so much negative stuff in their subconscious mind, which comes to attack you at your quiet moment without your permission, that the trauma that is disturbing people are feelings they have themselves brought upon themselves through the social media they consume. Social media has become now a threat to mental health, because some of what you see disturbs you in your quiet moments because with or without your permission, it is planted in your subconscious mind. What do I tell Kenyans? Stand guard at the door of your mind. The two senses to watch for are the sense of sight and the sense of hearing. What you are hearing and what you are seeing is getting implanted in your mind without your permission, and at your very quiet moment will come and become the trauma that is bothering you.
So it became